Hello friends, I am Dr. Sourabh Patwardhan from Nandadeep Eye Hospital PG Teaching Institute and FECO SICS Training Center, Sangli, Maharashtra, India. In our center, we have a lot of teaching activities which includes hands-on training as well. In this video, I'll be speaking about a case of brown cataract and how do we demolish it. So, removing a hard cataract from the eye is like the controlled demolition of a building, and we have to avoid all the collateral damage. So I have already done a big size rhexis, done minimal hydrodissection so that the nucleus rotates, and I'm going to use balance tip. So I set my Ozil setting to 80%. If I use regular Kelvin, I use 100%. With a balance tip, we can use 70 to 80% for even hard cataracts. So what I'm doing here is creating a kind of a crater, and the advantage of this is that not only I weaken the nucleus, I also get a sense of depth, so at which point I have to bury it, which is now I am doing. And I'm going to use the longitudinal 70% power with pulses, 10 pulses per second, to crack the nucleus. So important thing is to achieve that depth of penetration using the FECO tip. FECO tip is 1 millimeter exposed, so we have to bury that. And just watch my movement of the left hand holding the Sinski. I try to stretch it but avoid overstretching of the nucleus, because I don't want undue stretch on the zonules and the posterior capsule. Now the chopping continues. You can see the multi-level chop. So when I hold the nucleus right at the center of the nucleus, so depth is important, I make sure that I try to split the nucleus piece till the posterior plate, and that's very useful because if you have free piece, it makes the quadrant removal very easy. Now to the second heminucleus, again the depth at which I am holding the piece, and then multi-level chop going down with the Sinski till I crack the posterior plate. If you have difficulty in burying, or if you feel the buried tip depth is less, you bury it more. Now going to the quadrant removal mode, I am going to use torsional 70% with IP on. So what IP does is that whenever there is occlusion, it will give longitudinal pulses which avoids blocking of the tip. What I have noted with balance tip is that even without this IP, the tip doesn't get blocked that easily. So I think if you want to avoid IP, it's also okay. If you are using balance tip, with Kelman tip we have to use IP for such hard grade of cataracts. So now what I am going to do is emulsify each and every piece at the iris plane. I have already used the combination of chondroitin and hyaluronate to protect the endothelium, and that is very important for hard grade of cataract, because it's not just the phaco energy, but many times if any of the pieces come to the anterior chamber and rub on the endothelium, the chondroitin and hyaluronate will protect the endothelium better than methyl cellulose. But if you can avoid that completely, which is not always possible, then even methyl cellulose does a good job. You just need to replenish the methyl cellulose more often than Hylucoat, which contains chondroitin and hyaluronate. Near the last piece, what I am closely watching is the movement of the posterior capsule. Many of these cases we may have more redundant posterior capsule, and if there is any fluctuation that I notice, I will reduce the vacuum for the last piece. But here, as you can see, the posterior capsule is very much stable, and I continued with the same setting. So that's the end of the video. So the initial crater, judging the depth at which you have to bury, and the right settings, all these things are very important in tackling brown hat cataract. For more such videos, do subscribe to my YouTube channel. Thank you.